are now recording. So again, welcome to May 5th's virtual parent meeting. We are trying to be consistent with presenting information to parents and having an opportunity to communicate with you each month, the first Wednesday of each month. So the next one will be June 2nd, which will be just 2 days before the last day of school. So you can put that on your calendar, and we'll of course send an invite. I just have two small pieces of items before we get to our special guest today. And then after Jorge is done, we will have some results from the April survey to share with you, and then we'll wrap it up. We will be done by 4 o'clock, and so let's get going. So let's see. First, just a reminder that enrollment and inscripciones are open for the month of May 1st through the 20th of each month. The Milwaukee Choice Program enrollment is open. So todavía hay espacio en la mayoría de niveles. Most grade levels have space still in them. We have 50 seats per grade level, first grade through 8th grade. And we have 75 seats available K4 through K5. So most of those grades still have seats in them. So please enroll and tell your families and friends who are looking for a great school to also enroll. And secondly, summer school is coming up. And that starts at June 14th to July 15th. It's 5 weeks. El 14 de junio hasta el 15 de julio. No hay almuerzo. We don't provide lunch because the kids leave at 12:30, so they can eat as soon as they get home. We do provide a snack in the middle of that time, but the state of Wisconsin requires that we're in summer school for that amount of time, 4.5 hours. So that's why we have the time there. And this year we do have los dos opciones, virtual or en persona, virtual or in-person classes for summer this year. So we are confirming students who've been recommended, and if you would like your student to attend, you can call the office as well. All right, those are the two main things I wanted to start off with. I'm very happy to present a colleague who works at 16th Street Clinic. Jorge Mayorga is here to talk with you and to give you an overview of services. And then once we're done, I'm excited to talk just briefly about the potential of a partnership in the future with 16th Street Clinic. But without further ado, please welcome Jorge Mayorga. And I think I'll just, or do you have something to share, Jorge, like a presentation or?
I do. I have a PowerPoint. Would it be okay if I share the screen here?
Yes, there we go. Let's do it that way. So you do have sharing privileges.
Thanks so much. And if you can confirm that what you're seeing is a PowerPoint on your screen? I hope I did that correctly. Let's see. So I'm going to share the screen here. And then just for a quick question on the format. So is it okay if I do Spanish and then English, or?
Yep, that would be fine. As long as we get both in there. Yep. Yeah,
so I can definitely alternate between both. Hopefully you're able to see my screen now. So
we can. Yeah.
Okay, cool. So I will get started here from the beginning presenting. Ok, buenas tardes a todos. Muchas gracias al director Hanson por la invitación y voy a proveer una presentación breve de información sobre la clínica y luego vamos a abrir para preguntas. Si tienen preguntas en medio también podemos pausar y aclarar cualquier duda que ustedes tengan. So I want to thank Principal Hanson for the invitation here to be able to talk about the services that 16th Street Clinic offers the community. And really excited about presenting you this information. So first, just some quick framing. So we're going to look at the history of 16th Street Clinic in the community. We're also going to look at some of the school-based clinic services that we offer when we have partnership with school sites. And that includes the medical, behavior, primary care, and then many community health initiative programs. Vamos a ver hoy en la presentación un poco de historia sobre la Clínica 16 y el tipo de organización que es, y también sobre los servicios de que se ofrecen en términos de cuidado médico, cuidado primario y referente a salud mental y últimamente lo de educación para todas las familias, educación comunitaria. Entonces, ¿qué es un centro comunitario de salud? Básicamente hemos estado por 50 años en la comunidad proveyendo servicios de salud a la comunidad y esas son las áreas que ustedes notan ahí, que es el área médico, dental, salud mental, de sustancias, también tratamiento de sustancias y conexión a servicios sociales. So 16th Street Clinic has been in the community here in Milwaukee for over 50 years and providing comprehensive primary care services. And when you think of the services that are being offered, they're really those 5 key areas that you see there. So it's the medical, the dental, the behavioral health, substance abuse care, and connection to social services. Our mission is really driven around access for our entire community. So we want to make sure that quality healthcare is something that happens in our community and that happens in the clinic, but also beyond clinic walls. So school is a good example of that. And that care and access is free from any barriers that you can think of, from economic, linguistic, cultural, and those types of barriers. So we have programs in place to make our services available to everyone. Parte de la misión de la clínica es de proveer servicios a nuestra comunidad y queremos expandir ese cuidado de calidad, no solo dentro de la clínica, sino en la comunidad. Y entonces eso implica trabajar con escuelas y también que sea eliminando barreras, ya sean lingüísticas, o sea, de idioma, de cultura, económica. Tenemos dentro de nuestra misión de la organización evadir esas, romper con esas barreras. Disculpen. So the location sites that we are currently at, this is the list here, and you can always get an updated list from our website, but it's the Chavez location, so the historic, everyone knows the 16th Street, location. Then we also have a Parkway site, which is on 20th and right down close to Oklahoma. Layton Avenue. So if you've driven by the expressway and you've seen there that's a newer site off of Layton Avenue, and the services that are offered there. National Avenue is a new site. So this is a new behavioral health site that recently opened in February. We also operate a senior site at the UCC, Senior Geriatric Center, Community Center. And then we have presence in several schools, so roughly in 10 schools at this point, regarding medical behavioral health and community health initiatives. We also have the HIV Prevention Center and many programs around that, as well as the WIC program that you see on the intersect right there on Greenfield Avenue where those streets intersect. And then lastly, but not least, Waukesha. So we have a clinic, 16th Street Clinic, that's open in Waukesha and servicing that community. Lo que ve aquí en la pantalla son las clínicas donde operamos, que tenemos operaciones y proveemos cuidado. La de Chávez es la más reconocible porque está en la calle 16 al cruzar la calle del Rey, o digo al lado del Rey casi. Parkway, que está al sur, un poquito cerca a la Oklahoma, y es una escuela que queda a la vuelta del centro de St. Joseph, muy cerquita ahí de ustedes. También Layton Avenue, que eso del expressway, cuando manejan por ahí al sur de la Layton, está también ese centro, y también la Nacional. Entonces es un centro nuevo de salud mental que apenas abrió en febrero de este año, durante la pandemia. Entonces estamos ubicados ahí en la 18 y Nacional. También tenemos un centro para la población mayor, que es para de tercera edad, que es en el centro UCC comunitario. Y tenemos presencia también en ciertas escuelas. Actualmente estamos en 10 escuelas y es referente a lo médico, salud mental y programas educativos para la comunidad. También tenemos un centro de prevención de VIH y el programa WIC, que ustedes muchos han de conocer, que está ubicado ahí en la calle Greenfield, donde intersecta la 16, la Greenfield y varias calles allí. y último es Waukesha. También tenemos una clínica en Waukesha que opera. Voy a ir a la otra parte aquí que es de las escuelas y hablar un poquito sobre el énfasis de las escuelas. Esta es una lista actual de las escuelas donde nosotros tenemos clínica, ofrecemos servicios. Pueden ver que es salud mental, es un componente de esas escuelas. Lo otro es sobre los programas de educación como de nutrición, clases para padres y también sobre el cuidado médico donde hay una clínica dentro de la escuela. So what you're seeing here is the current school sites that we have partnership with for a school-based clinic. And so you see the behavioral health component where we're able to partner with schools and meet the behavioral health needs of the school. Also the community health initiatives piece where we have a healthy schools program, which does nutrition classes and different sorts of different environmental classes for the groups there, and as well as the medical clinic, which focuses on providing medical services within the school-based center. I'm gonna just glance through these next couple of slides because they're all really aligned here, but it really talks more in depth about the services in each of those key areas mentioned. So when we're talking about behavioral abuse, behavioral health and substance abuse disorder or substance use disorder, you'll see that list of the types of services that are offered. Same with the medical, so the care that's offered there. You'll see on the bulleted list, and I have another section that'll get a little bit more in depth on that. Also the dental specialty, case management services, and really a lot of the services around meeting chronic health condition needs of the community, parenting resources, connecting folks to the social services in the community, which I'm sure you already do a lot of this work there as well. And then the partnership with schools, so an emphasis on environmental health and the Healthy Choices program as well. I'm going to back up a quick second, just go over that in Spanish. Estos son los servicios de que mencioné al principio sobre salud mental, nada más que esta lista es más detallada y entra más a fondo sobre los servicios específicos que son ofrecidos en esas áreas. En términos de salud mental, en términos de médico, de dental y de especializaciones, de servicios especializados, ¿verdad? También algo de mencionar aquí es de que tenemos un programa del medio ambiente y de educativo sobre esto y sobre tomando decisiones saludables para las escuelas que implica como clases de nutrición, y bastantes programas relacionados con el positivismo dentro de las comunidades escolares. Últimamente aquí tenemos que recibimos un sello de Centro de Excelencia Nacional. Somos el 10% de los centros de salud comunitarios a nivel nacional reciben este premio y estamos muy orgullosos de haber recibido este premio recientemente. This is the HRSA, which is our federal government overseer. And so we recently received an award for a quality healthcare leader. Only top 10% of community health centers in the nation receive this award. So it's something we've worked very hard to attain and recently have received. So we're excited about that. During COVID, our response to COVID, was very immediate and very, with the testing. Now it's with vaccinations. En referencia al COVID, ¿verdad? La clínica, muy de pronto cuando empezó la pandemia, estuvimos haciendo todo lo que es de pruebas de COVID. Hemos proveído ya más de 20,000 pruebas a nuestra comunidad y mantener todas esas estadísticas de casos y hacer todo el seguimiento con los casos. So also noted that, we've tested over 20,000 folks in the community and have done the tracing of that as well and follow-up needed. And then this is the last slide that I have before we get into the Q&A piece, but it's basically how a school-based clinic offers functions within a school site. So schools have a service population where we're able to work with the students or the faculty or household members of the students, and that's really determined by the school. The teams that are at the sites are a medical assistant and medical provider. So if you think of the general services that are offered would be clinical services. So just as if they were to visit a main clinic site for a pediatric appointment, they would be able to receive those services in the school setting. So they're really broken up in these areas. So it's the acute, so in person, if a child is sick, needs to be seen by the provider, medical provider, they would be able to be seen on site. And then the primary care piece. So, well, child visits, sports physicals, immunization. They're also able to prescribe the medication for the students as well. So prescriptions is a part of that. And then also hearing and vision screenings. So we know that the screenings are so important at the school sites. And then case management of health conditions. So that includes the chronic health conditions with the asthma, diabetes, and we also work with children, you know, with their special needs. So whether that's an IEP or IFSP. Antes de llegar a la porción de preguntas y poder interactuar, nada más quiero resaltar cómo operan las clínicas dentro de las escuelas. Entonces, número uno, tenemos nuestra población dentro de las escuelas, que la escuela determina quién es visto en esa clínica, ¿verdad? Primordialmente esos son los estudiantes, pero si la escuela decide, queremos que también eso sea abierto a los maestros, a la facultad de la escuela, a los docentes. También si ellos deciden que los miembros de la familia del estudiante también pueden ser vistos en ese sitio, también se puede ofrecer esos servicios. En términos del equipo médico de que está dentro de las escuelas, es el asistente médico y es un proveedor médico. Y los servicios que ellos proveen dentro de esas clínicas son, si un niño necesita verlo porque está enfermo, ellos lo pueden ver, tratar cualquier necesidad física y de inmediata. También el cuidado primario, entonces eso implica los visitas de físicos anuales, físicos de deportes, vacunas, inmunizaciones, medicamentos si el estudiante necesita algún tipo de medicamento, y también las evaluaciones de visión y audición. Al igual que también cuidado sobre condiciones crónicas de salud que los niños tengan. Un ejemplo sería asma, diabetes, y también trabajamos con niños que tienen necesidades especiales conforme a sus planes educativos y planes familiares. Okay, so I think that covers everything, Principal Hanson. I'm going to stop sharing my screen now and hopefully get to answer some questions here.
Yeah, absolutely. Thank you so much, Jorge. I appreciate that. And as you can imagine, they are offering a lot of services to you, the families of SJA, families of the community, and we very much intend to be the 11th school on that list of 10 schools at some point soon. And we are working with Jorge and his team. You may imagine that there are quite a few steps to go through to make sure that that kind of a partnership can work out, but we are going to put all of our efforts into making sure that that happens. And I believe they only accept schools into the program once a year, so it might not be like overnight, but I just want you families to know that we are hoping we can create a partnership with 16th Street and SJA sooner rather than later. So that's very exciting for us, and we'll keep you updated on the progress around that. So while we have Mr. Mayorga here, are there any questions? You can unmute yourself and ask away. And I wonder, Jorge, if you can say what I said in Spanish, you might say it a little more fluently than I did, as far as the intention to try to create a partnership in the future.
Sí, por supuesto, el director Hanson ha dicho de que nosotros estamos en comunicación con los administradores de la escuela para poder desarrollar una colaboración entre las dos organizaciones, y algo que estamos trabajando a llegar es para eventualmente, ¿verdad? Cuando esté esa oportunidad de tal vez ofrecer una clínica dentro de las escuelas, ver una manera de poder programar eso Sabemos que es algo que va a tomar tiempo y desarrollo porque implica de que nosotros, mucha planificación en nuestra parte, pero es algo que estamos trabajando, ¿verdad? Y mediante, en realidad, y el propósito de esta junta es de tener una colaboración fuerte, ¿verdad? Dentro de los padres, la escuela y la clínica para que podamos ir desarrollando esa relación y poder apoyarnos, especialmente durante este tiempo de la COVID, ¿verdad? Y I'm going to just quickly say that in English because I did add something
Sure.
else, President Hanson. So, which is that, you know, we want to build this relationship with the families, right? And so we also want it to be the school, families, and the clinic. And so we're looking at ways that we can partner, you know, in the meantime, so that we can serve as a resource to your school community.
Thank you very much. All right, any questions? In 3, 2, 1. All right, well, thank you again, Jorge, and you're welcome to stay on. We will wrap things up in about 8 minutes here. So you're welcome to stay on the meeting. There are a couple more slides I'd like to get to. And if you are attending live here, feel free to unmute yourself and say, excuse me, if you do have a question before we wrap things up. So, yes, survey responses. I just wanted to share the most recent ones. And so I actually need to do a little skipping around here to get to this. Okay, so it's pretty similar responses to the first about a strong sense of community, very strong responses to that, and agreement, the Felician sister presence being an important part of the experience here. So a lot of these preliminary questions didn't change much, and so since we're a little pressed for time, I'm going to skip down to the SJA and COVID-19 questions, results. So as far as agreeing to continue virtual learning through June 4th, we did have strong agreement there. We had over 75% agreeing or strongly agreeing. We know that whenever we make a decision like this, it won't be popular with every single person, and we understand that. So we are trying to do everything we can to make sure all voices are heard and we're making the best decision possible. So thank you for that. As far as my child growing this year, we also have just under 75% of people agreeing with that statement as well. And the Spanish is there too, for those of you who speak Spanish. And then how pleased are you with the overall distance learning plan implemented? We have over 75% saying they're very pleased or saying it's okay. A few people with no opinion on that, and then a smaller percentage with being displeased with it. And then lastly, the summer school question, I want my child to attend summer school. We had 62% say they don't want their child to attend any type of summer school, but we do have 21% saying they do, only if it's virtual. And then we had 17% saying it doesn't matter whether it's virtual or in person, and that they would like to have their child in summer school. So I believe those are these are the parents we are contacting now this week to confirm your attendance in summer school this summer, and we will go from there. So, and we did get a lot of support for in these comments here, so thank you very much for that. We appreciate hearing from you, and we will continue to ask your opinion and ask you to share your thoughts and opinions every month. And so hopefully you can contribute those each month. So I'm going to come back to the presentation, if I can. Just a few more things left. Yep. Yep, so just a reminder that our curriculum is Reader's Workshop, so nomás para recordar que nuestra estudios en leer se llama Reader's Workshop. And this is the model that is the basic model for a Reader's Workshop lesson. There's a mini lesson of 15 to 20 minutes or so. Sometimes it's a little bit longer this year since it's a new curriculum for us. And then students have a chance to read, and then there's a closing time. So este es el proceso de una lección de leer normalmente. Lección pequeña es de 15 de 20 minutos. Este año quizás son más largas porque es un nuevo currículum para nosotros este año. So estamos aprendiendo cómo hacerlo en la manera mejor. Y nuestro programa de matemáticas se llama Everyday Math 4. Y vamos a explicar más acerca de eso en el futuro. So our next meeting, como dije antes, nuestra reunión próxima es el 2 de junio a las 3:30. Hoy fue 3:30. En el junio será a las 3 de la tarde. Tomorrow, next month in June 2nd, it'll be 3 o'clock instead of 3:30 like it was today. And I hope all of you can join. So there are 2 minutes left. Are there any questions that we can answer? And if it requires a longer conversation, we can discuss on the phone call or something, but I'll open it up here for any questions that you might have. ¿Hay preguntas en los 2 minutos que tenemos? Bueno. Well, if you are listening live or if you're listening this evening or later on YouTube or Facebook, thank you for attending our virtual parent meeting. Gracias por asistir a esta reunión. There's a question about the plan for dropping computers off. So we will communicate that. The short answer is that 8th graders will drop them off on June 4th and right before the parade. But then the rest of the grade levels, K5 first and second K5 first and second will drop them off on Monday the 7th. 3rd, 4th, and 5th will drop them off on Tuesday in the morning from 8 to noon on Tuesday the 8th of June. And then 6th and 7th grade will drop them off on Wednesday. So we'll post like a schedule so you can see it better, but that's the plan. So vamos a poner el plan de entregar los laptops, los Chromebooks y los grados de K5, primera y segunda será el lunes el 7 de junio, tercer, cuarto y quinto grado el jueves, el 8 de junio, no jueves, martes, el 8 de junio. Y el sexto y séptimo grados serán en el miércoles, el 9 de junio. So vamos a poner un horario en el Class Dojo que va a explicar eso. Buen pregunta, good question. Thank you for asking. And as far as next school year's plan, again, we will be looking at the data. So we have always planned on having summer school be having the option of virtual or in-person. Our goal is to be completely in-person come August. And based on the data, I just have a feeling we're going to have to offer a virtual option. But, no one can predict the future. So I can't guarantee that it'll be fully in-person because if the pandemic swings the wrong way, it might not be safe to do so. But based on the current information, we're planning for a full in-person experience in August, and possibly with the virtual option if parents are uncomfortable with that. So nuestro plan por el año escolar que viene será en persona total, pero como todos saben, es imposible saber el futuro. So, vamos a hacer las decisiones más seguras para todos, pero con la información que tenemos ahorita, el plan, ojalá que podamos ofrecer una experiencia en persona total con la opción de virtual, pero no, no es la decisión final, nomás es lo que estamos pensando ahorita con la información que tenemos. So, pero vamos a poner nuestra decisión final más en el verano. All right, good question. Thank you for asking that. Gracias por esta pregunta. Okay. Well, you know where to find us. Ustedes saben cómo comunicar con nosotros. So, por favor, danos nuestras sus preguntas si tienen después. If you have questions later, please, by all means, call or email or send us a message on Dojo. All right, it's 4:02. Thank you very much for your time this afternoon and have a great rest of your day. It's sunny outside, so go outside and enjoy. Have a great day.